Whenever I ask students about what they want to work on in the clinic, the #1 answer I always get is pulse diagnosis. So let's go over some basics about how to take the pulse, some common mistakes I see students making, and some tips about how to level up your pulse taking skills. When it comes to taking the pulse, there are a lot of things that are just a matter of style or personal preference. You can take the pulse with a patient sitting or lying down. You can take the pulse one side at a time or both sides at the same time. You can lay your hand flat across the back of the patient's wrist, or you can place your thumb on Sanjiao 4 and push the pulse into your fingers. You can feel all 3 positions at the same time, or you can lift the fingers to feel one position at a time. So these are things that you can experiment with and see what works for you. However, there are some things that you should be doing regardless of personal preference or particular style that you're practicing. #1, make sure you have the correct finger placement. Make sure you always place the index finger in the Zun position and the ring finger in the Chi position. Don't take the pulse backwards. And then you need to make sure that your fingers are at the correct level on the wrist. The way you do this is you use your middle finger to find the patient's radial styloid process, and then you wrap your fingers around until you find the vessel. Your index finger should be between the base of the thenar eminence and the styloid process. Your middle finger should be level with the styloid process, and your ring finger should be just below it. Sometimes I see students taking the pulse and their fingers are shifted down an entire position. So they think that they're feeling the heart pulse with their index finger, but they're actually at the liver position. So make sure your fingers are in the correct position by lining up your middle finger with the radial styloid process. Tip #2, use light pressure. The biggest mistake I see beginning students make is that they press too hard. When you do that, you might be able to feel the beats, but it's going to be much more difficult to feel the shape of the vessel or the quality of the pulse. So one piece of advice I like is, imagine a butterfly landing on your wrist. That's how light your pressure should start. So land your fingertips on the wrist as light as a butterfly, and then very gradually increase the pressure until you can just feel the shape of the vessel and the beating of the pulse. According to the Nanjing, the superficial levels of the pulse are felt by applying a pressure equal to a weight of 3 beans. Now some people like to argue about what this means, whether we're talking about mung beans or kidney beans. I don't think it really matters that much. The point is, 3 beans does not weigh a whole lot. So you should start by applying very light pressure, and then you can explore the various levels of the pulse by pushing down to the bone and coming back up. But when you first land on the pulse, try to be very light and then explore deeper. Tip #3, take a systematic approach to feeling the pulse. Here's what I mean by that. Sometimes you'll hear people say things like, try to connect with the chi of the patient, or listen to what each position is trying to tell you. Now that might sound nice and poetic, but at least to me, that's just not very practical. So instead, I like to recommend a more systematic approach to taking the pulse, using the initials RDSQ, which stands for rate, depth, strength, and quality. So when you're taking a pulse, start by asking yourself, what's the rate? Now finding the rate is pretty simple. You just count the beats. If it's greater than 90 beats per minute, that's a rapid pulse. If it's less than 60 beats per minute, that's a slow pulse. After you've been taking pulses for a while, you'll start to have a sense of what rapid and slow feels like without having to count the beats. But in the beginning, just look at a clock and count the beats. D means depth. After you've established the rate by counting the beats, you can now ask yourself, what's the depth of the pulse? That is, do you feel the pulse immediately on the surface when you first touch the skin? Or do you have to push down towards the bone in order to feel the pulse? If you feel the pulse on the surface, that's a superficial or floating pulse. If you feel it deeper, closer to the bone, that's a deep pulse. Now this might be difficult at first. You might need to feel 100 or 1,000 pulses before you have an idea of what constitutes superficial and what constitutes deep. So for now, just ask yourself, how deeply do I have to press in order to feel the pulse? S means strength. When you feel the pulse, how strongly does it push against your fingers? Is it strong and forceful, or is it weak and forceless? And again, this may take some time to build a reference point for what constitutes strong and what constitutes weak. For now, when you're taking the pulse, just ask yourself, how strongly is the pulse pushing against my fingers. Q means quality. Really, when we say quality, we're talking about the 28 or 29 pulse images. But these might take some time to learn, or you might not fully understand them yet. So for now, you can start by asking yourself some basic questions, like, what is the shape of the actual vessel? Or more specifically, what is the diameter of the vessel? If the vessel is wide or has a large diameter, that's called a large pulse. If the vessel is narrow or has a small diameter, that's called a thin pulse, a fine pulse, or a thready pulse. These are all just different translations of the word shimai, and it's referring to the diameter of the vessel. Next, feel for the edge of the vessel. Do you feel a distinct sharp edge, or does the vessel feel soft and squishy? If you can feel a hard edge, you might be feeling a wiry or bowstring pulse. And then, and this might sound weird at first, but think about how the blood is flowing through the vessel. If the pulse is coming and going smoothly, that's called a slippery or rolling pulse. If the blood is not flowing smoothly through the vessel, if the pulse comes and goes abruptly or seems to speed up and slow down, then that's called a rough or choppy pulse. So slippery and choppy are two opposite pulse images, and they refer to how smoothly the blood is flowing through the vessel. So these initials, RDSQ, give you a systematic approach to taking the pulse. Start with a rate. Ask yourself, is it fast or is it slow? What is the depth? Is it superficial or is it deep? What is the strength? Is it strong or is it weak? Then with the quality, you can start by asking yourself, what's the shape of the vessel? Is it large or is it thin? Can you feel a distinct edge to the vessel? And how is the blood flowing through the vessel? Is it smooth or is it rough? And then, after you have this overall picture of the pulse, you can then maybe start investigating the individual positions on each side. Sometimes an easy way to start is to ask yourself which position is the strongest and which position is the weakest. And tip number 4, and this might be a more difficult or more long-term one, but if you really want to be a master of traditional Chinese pulse diagnosis, you need to memorize the definition of each of the 28 pulse images. This is something that Bob Flaws really emphasizes in the introduction of his book, The Secrets of Chinese Pulse Diagnosis. In it, he writes, "In my experience, the secret of Chinese pulse examination is exactly this. One cannot feel a pulse image unless one can consciously and accurately state the standard textbook definition of that pulse image." So basically, if you don't know the definition of a soggy pulse, you'll never be sure if you're actually feeling a soggy pulse. So I know that not a lot of students are into memorizing information in this way, and it just takes a lot of time and a lot of effort. So that's why, in the meantime, I still think it's a good idea to start by asking yourself some basic questions about rate, depth, strength, and quality. And that way, you can start sensitizing your fingers to the pulse, and you can still get some pretty good diagnostic information just by asking these simple questions. And tip number 5 is to be patient. I've seen some sources say that learning to take the pulse is considered a 10-year process. So don't expect to be a pulse master after just 1 semester or 1 year of learning to take the pulse. The best thing you can do is to keep practicing. Keep a pulse journal. Take 10 pulses per day. After a couple months, you'll have taken 500 pulses. Or, if you want to be very serious about it and take the Bob Flaws route, start by memorizing the word-for-word definitions of the 28 pulse images. So I hope this was helpful, and I hope you enjoyed this video, because that's all for today. Thanks, and see you next time.